Dr. Wilson Pace spoke at the American Academy of Family Physicians Scientific Assembly about new approaches to healthcare delivery.
Their primary messages are, well, what's possible with a well-designed healthcare system to not only improve outcomes, reach out to a community, but do so within the constraints of our current healthcare dollar. It also talks about how you might reorganize and the focus of reorganization and what it takes at a primary care level to make that happen. And it is much more resource intensive at the primary care level to make that happen, but the overall costs become actually lower. Models of reaching out to the community and going beyond just delivery of health care to how you achieve health, putting in social systems, thinking about community resources are all activities that are not usually seen in our current healthcare system. The biggest issue is changing the way the healthcare dollar flows and getting rid of the siloing of dollars between inpatient, ambulatory, pharmacy, lab benefits, because ambulatory and other costs go up dramatically, and if all you look at is that side of things, then you're just talking about increasing your healthcare costs, but the savings come from the other side of things. So you really have to be able to move money between those silos that exist in our current activity, which means typically you need somebody that can take the risk of a capitating or the whole package. So that means that in the current environment, they'll need somebody that has the capital to take on the risk early on, because it takes some time to see those savings. They don't happen just in the first 6 months. Medicare has a number of different programs going on right now to test models like this. Many of them are hospital driven, and I think that this one is relatively interesting in that it doesn't have a hospital in it at all, and it's primary care driven. And that changes what they see as the important issues of bottom line. Decreasing hospital days by 60% isn't a bad thing if you're not a hospital-driven system. So I don't know if they're perfectly like this one, but there are a lot of models going on right now exploring these kind of options.